Hello, Marc.
Hello.
It's so nice
Tatiana.
to see you here in Sao Paulo during this World Hepatitis Summit. And thank you very much for the opportunity to talk to you. I would like to ask you about the first global report, and if we compare it with the baseline when we started with the strategy, global strategy, can you share with ELPA what lessons we learned and which activities and actions we should focus on in the near future?
Okay, thank you very much for that question. We have published a global hepatitis report at WHO last April that showed the baseline data of 2015, where we have an estimated 71 million people that are living with hepatitis C, chronic infection. And of course, we also have over 250 million people that are living with chronic hepatitis B. Now, in the European region, hepatitis C is particularly an issue, and we want to make sure that this is well addressed. Based on the data that we had available then, about 20% of people living with hepatitis C have been diagnosed. So there is still enormous room for improvement to diagnose, to test, and bring those people, link those people into care. The cost of treatment is still high in most places in the European region because there is not always access to generic drugs. However, the prices have been coming down also from the innovator companies, and I think it is becoming more and more feasible for countries to really treat all patients with hepatitis C. And that is how we will be able to eventually eliminate this infection from the general population.
So elimination is basically something realistic, because a lot of governments, a lot of countries do say, okay, maybe it is a little bit too ambitious, but if we all focus our actions, maybe we can do it.
Yes, I'm sure that we can do it if we really focus our attention and our resources on this. You look at the countries that are really taking the lead now. They're all countries that have very high prevalence rates of hepatitis C. You look at countries like in the region, European region, countries like Georgia, also countries that are that now have a treat-all policy, like Portugal, Germany, Switzerland just recently,
no restrictions.
France. There are no restrictions now, and those countries are really moving ahead. In other regions, we have Egypt that is moving very quickly now, has over 1.4 million people that have already been treated for hepatitis C. We have Mongolia that is doing very well and has a very high burden. Mongolia actually has the highest incidence of hepatocellular carcinoma in the world, both from B, C, and D. So they have a very high prevalence of all three viruses, which causes a very high liver cancer rate. But they're really taking the bull by the horns, and they are implementing programs that actually allow everyone to be treated. There is a small copay in many countries. It's not always free treatment, but for instance in Mongolia the copay, I believe, is 20% of the cost. And so the other 80% of the cost is paid by the National Health Insurance Program. And we as WHO, we really encourage that model, because that would allow universal healthcare, essentially paid for through a health insurance plan.
Thank you so much for sharing with us these best practices. Thank you.